At the end of World War II, there were a lot of veterans who were moving to Florida. Many of them were injured during the war, many of them needed follow-up care, and there was no medical school in the state. And the state legislature started asking questions of the university, should we build a medical school? And the president at that time, J. Hillis Miller, put together a committee and said, should we build a medical school? And the committee was a really thoughtful group, and they came back and said, no, don't build a medical school, build a health science center. Bring together all the different health-related professions onto one campus and have an opportunity for those folks to work together in an interprofessional manner in their education, because they're going to be working together in the clinic later on. Darrel Mase was part of that group, and he took that idea one step further and said there are a lot of professions or budding professions such as physical therapy and occupational therapy that don't have academic homes, and said why don't we create a college for them? And originally it was called the College of Health-Related Services, and the first three departments were physical therapy, occupational therapy, and medical technology. And he saw the benefits of integrating those different services together in one place, where the comprehensiveness of the care that patients received improved the quality of the care that they received. And he took that same model then and said we ought to have a college that does that trains these different professions together. And the college opened in 1958. Dr. Mase was truly a groundbreaking individual, a trailblazer, a pioneer, if you will. He believed in this so strongly that he proselytized across the country, telling other places, here's a model that you ought to use. And he was so successful in doing that. By 1965, the Secretary of Education for the United States said this is a wonderful model. And it led from our being the first college of its kind in a health science center to more than 70 other colleges of its type being formed across the United States. One of the pieces that Dr. Mase was not successful in getting early on was public health into the college. And it wasn't until the 1990s that we succeeded in getting approval from the state to offer a degree, a master's in public health. And then by 2003, we had the good fortune of getting approval to expand the college and become the College of Public Health and Health Professions. Now, the significance of that is that we now cover the entire spectrum, from trying to prevent illnesses and promote health to treating illnesses and performing important services related to rehabilitation, the entire spectrum of healthcare. And a lot of that was due to the foresight and ingenuity of Dr. Mase. And I'm really proud to be part of the legacy of Darrel Mase and what he began back in 1958 when he founded the college.